So, Mom.
Diana Pepin had her fears that something was happening to her incapacitated mother behind the walls of her nursing home. So she installed a camera. At first, what she saw was reassuring.
This is the PSW who has taken care of Mom for several years. She's having an interaction with my father.
That's what I do. I'm color coordinate.
She's showing how well she dresses Mom. She color coordinates for her.
It sounds caring.
Very nice. The socks are matching the nightgown. It sounds good.
But as soon as Diana's dad leaves, that nice talk disappears.
Die, you bitch, and you could die no.
Oh, it makes you not trust people. You know what? It just makes you not trust your own judgment sometimes when you think people are okay.
The personal support worker in the video was fired, but there are plenty more cases like this across Ontario. A review of hundreds of government incident reports found residents had been physically assaulted by staff when they requested to have their adult diapers changed. Another resident was left in a badly soiled state for 2 hours by staff intentionally.
So I think that's a bit of a...
We told elder advocate Jane Meadis about some of those reports.
We found a PSW, a personal support worker, returning to work after an allegation of abuse without any further training, another incident of resident-to-resident sexual abuse, and then finally resident-to-resident abuse that took place while the staff were asleep. Are these isolated, or do you hear about things like that all the time?
I hear about these things all the time. We hear stories of people being illegally detained, of being left in bed for days, filthy conditions, cockroaches, assault.
Indeed, the reports show a surge in incidents between staff and residents reported by nursing homes, from almost 900 in 2011 to about 2,200 in 2016. When problems are reported, it can take months for officials to send an inspector.
We still have a huge backlog, and I think we still have a big problem because they're inspectors, they're not investigators.
So now, when staff come to her room, Diana Pepin keeps watch, a safeguard against abuse in a home that was built for care. David Coleman, CBC News, Ottawa.
Now, David's story is your first look at a major investigation into the crisis in elder care. In the weeks to come, you'll see in-depth coverage on CBC's Marketplace and here on The National. It's the scope of the problems, the calls for accountability. So tonight, let's focus on the staff on the front lines and what happens when trouble strikes. Marketplace found that in just 1 year, there were 2,198 reported incidents of staff on resident abuse in Ontario long-term care homes. This means, on average, 6 seniors abused every day. Now, many of the staff in those homes are personal support workers. That's a demanding job that pays relatively little, about $18 to $21 an hour. They're not recognized as regulated health professionals in Ontario. They're not certified, and there's no governing body regulating practicing PSWs.
Currently, any PSW in the province of Ontario can abuse, they can steal, and if they're not formally charged by the police, they can leave that place of work, walk down the street, and get hired at another long-term care facility.
And that exact scenario has played out. Remember this video? In Ontario, a few years ago, some support workers were caught on camera, one waving feces in a resident's face, another blowing his nose on her sheets. Well, at least one of those people is still employed as a personal support worker. So how can anyone check up on who is caring for their loved ones? Ontario did have an online registry of more than 35,000 PSWs. 2 years ago, it quietly dismantled it over complaints it contained unverified information. The government promised a replacement to be phased in starting now, but there's nothing available to the public yet.